We're taking you behind closed doors inside a local COVID-19 unit as the virus hits local hospitals the hardest. Now, almost 2 years into the pandemic. Our goal is to show you what these numbers look like in real life. You can see we've hit a record number of hospitalizations, surpassing these other peaks. We also want to share the real stories of these doctors and nurses and how they're coping with the everyday toll.
I'm a broken doctor. So many of us are disillusioned. So many of us are at our wits' end. We are so fatigued.
But there are things you and all of us can do to offer encouragement and change.
Now, we want to warn you, some of what you're about to see may be difficult to watch. KSHB 41 News reporter Dan Cohen takes us inside the COVID-19 unit at St. Luke's Health System.
COVID-19 can be characterized as a pandemic.
On March 11th, 2020, the World Health Organization declared a global pandemic. 688 days later.
Every day is the same as the previous day. It's Groundhog Day in the emergency department, and really in healthcare.
The battle continues at St. Luke's on the Plaza in Kansas City.
Every time we come to work, we think maybe we're gonna be past it. Maybe today will be a slower day, and every day seems to be kind of the same. It's so frustrating.
This was my third visit to the front line since the COVID-19 pandemic began. September of 2020. August of 2021, and now January of 2022. Over the past year and a half, much has changed. But here inside St. Luke's, there's frustration over what hasn't. We talked to healthcare workers in the ER and ICU, and they say it's been a roller coaster.
It's gone up and down and back and forth a lot over the 2 years. We've have moments of great joy when we do see some of the successes, and unfortunately this unit especially, the successes are the exception, not the rule.
Just steps away from battling COVID-19 in these filled hospital rooms, the conversations were heavy.
Just what are you at mentally and emotionally right now?
Oh, so done. So done.
I'm a broken doctor. So many of us are disillusioned. So many of us are at our wits' end. We are so fatigued, and we're worried that we don't see an end of this in sight.
This is the worst day of their life every day. This is just a Tuesday for me.
How do you cope with that? Do you have any coping mechanisms at all?
My faith. That's all I have.
How do you cope?
Just working out, counselor, do the best I can.
Finding coping mechanisms and really diving into both the emotional and physical state of everything through the last 2 years has been important, as we get told how important it is to take care of yourself and check in with yourself while you keep doing this, and I can't stress it enough.
How important is it for you to kind of check on everybody?
And top priority. All the time, every day, as much as I possibly can.
But you also have to take time to check on yourself too, right?
They check on each other when they can, fighting together, fighting for their patients, and fighting misinformation and doubt.
In terms of skeptics who are going to see this, the hospital benefits from the pandemic. Doctors benefit financially from the pandemic. What do you say to that?
I would trade any of those concerns, which are unfounded, to not have had the last 3 years of my professional life. No one that I have ever talked to or shared medical care with has ever voiced anything positive from any variety out of this pandemic.
Almost 2 years to the day since the first case of COVID-19 was identified, this staff and their fellow fighters have not forsaken the front line.
We have exceedingly resilient nursing staff, medical staff, and then all the other ancillary workers. All those people continue to come to work every day.
Our goal is to do the best care for everyone, no matter what, every day.
And as you just saw in that report, this is a very tight team. And one of the nurses you just heard from told me that togetherness really helps them perform their jobs, which continue to be a challenge as there are many, many patients in need of their care. Kevin and Dia.
He said, a broken doctor. Dan, what's the biggest thing that kind of stood out to you during your visit here?
Yeah, Kevin, I think the biggest thing that stood out is that even though they're under such duress and stress, they have such steady hands, and they really see everything as routine. It's just part of their job. These are scary moments, and these are steady hands that are taking care of these patients. They're showing up to work every day. That really stood out to me. This has been going on for a year and a half, and they're just showing up to work and doing the job.
They're heroes.
Really? There's no way to overstate that. Dan, thank you.